that community. On Thursday, I joined local leaders and company executives in Horse Cave as T. Marzetti broke ground on the company's largest ever expansion, and it's here in Kentucky. A $133 million project is going to create 220 jobs in Hart County, and that project even grew from its initial announcement. These are just the latest of the more than 2,750 new jobs we've announced just thus far this year. That is almost double the number announced for this period of last year. Businesses have announced plans for 33 projects in Kentucky with planned investment of nearly $1.5 billion. A majority of these jobs have above average wages, another key mission to expand opportunities and increase wages across this Commonwealth. Last year, across all incentivized new jobs the state announced, I believe we had the second highest wage in our history, or at least since 2015. Future looks bright. As we emerge from this pandemic, we continue these announcements. A direct sign of economic activity was the best April ever for sales tax as well as vehicle usage taxes. Kentucky is open for business. You look at Site Selection Magazine, last year, even in the midst of a pandemic, #1 in our region, #1 for states with under 5 million people, #3 nationally per capita. You look at what Fitch's did in upgrading our economic outlook for strong economic recovery. And you just look at these last 2 months where we've been on fire with economic development activity. And folks, the best is yet to come. The present, still challenging. The immediate past has been quite tragic and difficult. But I think the future is really bright and exciting. So once again, buckle up. There's a lot of announcements coming up. There may be one late this week or early next week that is truly, truly exciting. Whole lots of really good jobs. So more to come. All right, let's get into vaccines. So one thing that we know is that people need to hear more from those in their community, trusted leaders. And so today we're coming to you with a message from a well-known coach in Eastern Kentucky.
I'm Coach Mack, head football coach at Pikeville High School. I didn't have any hesitation about getting a vaccine. Well, I have several friends in the healthcare industry who, they think you need to get it. And, they went to school and they're experts in their field. And, I'm going to listen to those kind of people because selfishly, I want to be back to as close to normal as I can get. I want my family, my friends, my colleagues, my players to feel comfortable, kind of being around me and getting back into more group settings. I've been coaching a team sport for nearly 30 years, and I think that the success of the group is due to each individual person's effort. And that's the way I see this. We all have to do our part if we're all going to get through this together.
All right, thank you to Coach. And today, excited to know that in Kentucky, we've now put 1,927,168 first doses of these vaccines into people's arms. When you also subtract folks that we have vaccinated from out of state, but then add Kentuckians that have been vaccinated out of state, we believe 1,939,657 Kentuckians have been vaccinated. Overall, 54% of our adult population now, at least with their first shot of hope. 80% of Kentuckians 65 and older. Almost 60% of Kentuckians 50 to 64. But then we drop off from there, folks. If you're 40 to 49, need more of you to get the vaccine, just 45%. 30 to 39, just 40%. 18 to 29, just 29%. When we go over today's report, the 10 to 19-year-olds have the highest incident rate in today's report. And then it's that next age group with the second highest. We're actually seeing a very low incident rate in our oldest seniors. And again, this virus is shifting. Who is getting infected because of who is, but more importantly, who is not getting the vaccine. Top 5 counties. Welcome to Campbell County, breaking in the top 5 with 47% of their population vaccinated. Good job. Keep it up. To those in the bottom 5, I know you're working hard. Let's try to find ways to get more and more of our citizens vaccinated. As a reminder of some announcements we made, with 1.9 million Kentuckians having made the choice to get vaccinated, again, 54% of adults, 80% of adults over 65. That's why last week I announced that on May 28th, the state would be moving to 75% capacity for all restaurants, venues, offices, pools, and that's now applied to events both under and over 1,000 people. So May 28th, 75%. At that time, the curfew will end and a number of other restrictions will be lifted. Last week, we also announced that we would immediately follow the Center for Disease Control and Prevention's recommendation. Fully vaccinated Kentuckians no longer need to wear a mask in most places, with a few exceptions like hospitals, long-term care facilities, airplanes, public transportation. Then Kentuckians as young as 12 on Thursday started getting their shots of hope here in Kentucky. So on Friday, I announced that we'll return to 100% capacity for all venues and events in what was 1 month from the last Friday on June 11th. On June 11th, we'll also eliminate our mask mandate for all Kentuckians with the exceptions of places where people are the most vulnerable. So in less than a month now, life's going to look fairly normal. So why the month? Let's go over this again. It was only last Thursday that Kentuckians 12 to 15 could start getting vaccinated. I believe they deserve the opportunity to get fully vaccinated before people's contacts increase significantly. It also gives notice to everybody else. There's going to be more potential for exposure as things are even that much more normal. So this gives you time to get fully vaccinated or on the way to being fully vaccinated before that June 11th. Folks, get vaccinated. We've lost 6,600 Kentuckians. We need you to protect yourself and those around you. Also remember that some businesses in some areas are going to decide to keep masking requirements in place. You ought to respect them, right? That is their choice. And if they're trying to provide that extra level of safety, you need to respect that. Carry your mask on you. Use it when you need to. And also, let's respect people out there who continue to wear them for different reasons. That certainly ought to be their choice. And there may be many reasons they need that extra level of protection or they're protecting others around them. Let's continue to have compassion and show understanding for one another. Vaccine openings. Basically, anybody who wants one can get a vaccine. Everybody who wants one that qualifies can get one before June 11th. Go as soon as you can. Here's a breakdown of places that have hundreds, if not thousands, of appointments. All right, let's look at COVID week over week. Let's show our stair-stepper chart. In good news, this week that we just finished had fewer cases than the one before. We're actually on a 3-week decline, though the decline is fairly small. We hope that it is a trend, but this may just be part of the plateau. In just as good news, the positivity rate has gone down each of the last 3 weeks and right now is under 3%. Certainly, if this continues in that direction, it is very good news and would make our timing of normalcy and a full return to normalcy. You know, it's hard to argue our economy isn't fully open when we're breaking records on sales tax of all time. But as we return more towards normalcy, it'll be nice to hopefully see these numbers continue to decline. Hospital capacity, that map we show still in pretty good shape. Region 10 is the one that's for ICU beds been like this for a while now, but plenty of capacity throughout the state. All right, COVID update for today. 285 new COVID cases. That is around where Mondays have been in the past 3 or 4 weeks. Positivity rate now at 2.78%. We like to see that low. Hospitalizations, ICUs, ventilators, all fairly flat. I think ventilators are up a little bit today, but sometimes that's just the way that it's reported. Incident rates by age. Highest incident rate for today is 10 to 19-year-olds. Very close to that is 20 to 49-year-olds. When you look at 50 to 79-year-olds, it's only half of those other two groups, and 80-plus-year-olds is almost a quarter of the incident rate of 10 to 19 or 20 to 49-year-olds. So what does that say? It says if you are between 12 when you qualify and 49, not enough people are getting their vaccines. Please get out there and get it, because people in your age group are getting the virus at a higher rate than other age groups. Today, we're announcing 6 new deaths. They all come from the regular reporting system, and they are all March and April deaths. These are Kentuckians that we've lost, whose families are going to need us. There's a 66-year-old woman from Davis County. That is in April. A 71-year-old woman from Fayette County, April. 55-year-old woman from Greene County, April. 67-year-old woman from Jefferson County, April. 69-year-old man from Jefferson County, April. And a 62-year-old woman from Pike County. That was in late March. With that, and with these, hopefully, winding down as we get close to that June 11th date, we will go ahead and open it up for questions. We have a long list of reporters today, so I'm going to ask everybody to limit their questions to one so that everybody can get in. If you choose to ask more than one question out of respect to other people on the list, I'm going to answer the first one. So let's start with Shelby Smithson from WKYT.
Thank you, Governor. We've heard from several business owners concerned about their staffing shortages, especially when we return to that full capacity next month. They say until enhanced unemployment benefits end, there's not a lot of incentive for some people to return to work. So with that, will Kentucky follow other states and opt out of the federal unemployment benefits that provide that extra $300 a week?
Well, what we want to do is we want to be smart. We want to make sure that our economic recovery continues, and then we want to make sure we can sustain it. Right now, those PUAs, the extra unemployment benefits, are putting about $34 million a week into our economy. They are going into groceries. That's the number one thing being bought. They're going into retail. So an immediate termination of those extra benefits would hurt our economy and hurt a lot of groups, restaurants and others that have suffered during this pandemic. It would put a shock through our system, and it could threaten the way that our recovery is going. Now, they cannot and they should not continue forever. So what we have to do is we got to thread this needle. In other words, not try to say we're a red state or a blue state and we're deciding it because of that. We got to look at what's best for our economy to keep it growing as fast as it is, to rebound and help our small businesses that depend on spending dollars rebound as fast as we can, while at the same time getting people back into the workforce. Part of the workforce issue is, remember that the vaccines were only available in December. Most people couldn't get them until February or March, with the 1 month that it takes to get fully vaccinated. We have a whole lot of people that have been out of the workforce that are just now getting fully vaccinated. So some of this will work out on its own. And then again, we're going to work on a strategic approach where we can get every benefit that these dollars are providing to our economy while making it sustainable and getting people back into the workforce so we can continue the growth that this is in part helping on. Karen Czar from WKY. I promised today to have short answers, and I already blew that.
Good afternoon, Governor. Hello, Virginia. Governor, I've talked to some business owners, just a few, but they're still getting people requesting, saying that they worked for them and they went out of business, or trying to request unemployment, but they were never part of that company. And they are also having trouble getting in touch with the UI office other than sending back written responses. Is there any other information that we can give to them as far as contacting the office about these fraudulent claims? Thank you.
Today we've got Amy in court. I'll have them touch base with you directly. We need for folks to continue to report those into UI. And our challenge is chasing every one of those downs and processing benefits when there's a limited number of people, but we're working to get all of it done. It is important that they report each one. Alex Akisto from the Herald Leader.
Hi, Governor. I believe the last time you gave an update on correctional facilities, maybe it was a month ago, you said that before visitations could resume, all visitors would need to be vaccinated and herd immunity basically would need to be reached among those housed in those facilities. Have visitations resumed yet? And if not, when specifically will they? Thank you.
Thank you. So visitation has not resumed yet. I'm waiting on a firm date that we're going to be able to offer it. Part of it has to do with the system where you request visitation as well. To date, 70% of inmates housed in state prisons have been vaccinated. That is a really good number. And we need to work towards opening up visitation for vaccinated inmates with vaccinated visitors. Again, this is a congregate care setting where we have seen this virus spread rapidly through it, and we want to make sure that we can open up visitation, but still provide that layer of protection. It is time we move towards and get a firm date for visitation, and I should be getting that this week. It does have to do with the system through which they route requests and ultimately schedule them. Tom Latek from Kentucky Today.
Good afternoon, Governor. Ever since the mask mandate was announced, remember I went to a restaurant Thursday night and, everyone was just like overjoyed. And it was like a whole new, I know it was like New Year's Day or something like that, you might say over there. But there's still a lot of confusion. People I've talked to over the over the weekend on the mask mandate, and some businesses are still enforcing it, some aren't. I'm talking about retail. Do you think maybe this was rolled out a little bit too hastily without all of the factors being included before the CDC said, yep, let's do it?
Well, I think the CDC caught us all by surprise, but it was good news. And if they, which my understanding is they got back some really big federal studies that convinced them of how safe you are if vaccinated. Listen, once they knew that, they don't need to waste time calling me before they tell the people of Kentucky and of America. So it's pretty simple here in Kentucky, right? Until June 11th, if you are vaccinated, you don't need to wear a mask inside. If you are unvaccinated, you ought to be wearing a mask inside because you are not sufficiently protected. June 11th, that goes away except in some certain settings. There are also certain settings that vaccinated people have to wear it. But what people are now saying confusion, we also have to understand is choice. A business has a choice if they want to provide an extra level of protection to their workers to continue to require wearing masks. It's almost, remember we talk about no shirt, no shoes, no service. This ought to be the option that different businesses have. Now, does it mean you walk into some places and not have to wear one and other places and have to? Yes, but I think we can all figure that out. Kelly Dean from WBKO.
Hello, Governor. Hold on, my question. Okay, so kind of going off of masks, obviously the new mask mandate does not apply to anyone at schools. Do you all expect to lift the mask mandate for schools in the fall?
I do not think there will be a mask mandate for schools in the fall. I don't expect it based on what we are seeing with COVID. We will watch everything, but right now I think kids will be back in a very, very normal setting. That does include information where we believe there will be the opportunity for kids younger than 12 to be vaccinated by the time they go back. I'm very much looking forward to a full normal school year for my kids and for everybody else's. Sarah Ladd from the Courier-Journal.
Yes, thank you. Could you clarify if the physical distancing requirements drop at the same time as the mask mandate? For example, on June 12th, if you walked into a business or restaurant, would lines of people not need to be spread out or tables not spread out, et cetera? Thank you.
Yes, on June 11th, the distancing guidelines are being pulled back as well, though let's be smart, especially if you haven't been vaccinated, give some people some space. And remember, we spent 14 months, 15 months standing 6 feet apart. You might not want to stand a foot from somebody else, both for their own personal space. And again, remember, this virus is still out there. You know about it by now. You know how it spreads. So be cognizant of others. But yes, tables will not have to be 6 feet apart beginning on June 11th. Monica Harkins from ABC 36 News.
Hi, Governor. Hi, Virginia. I have a question regarding our vaccination cards. Those are kind of the golden ticket in this post-pandemic world. And we know with official documents, there can be scammers involved in all of this. When someone, maybe a business, asks them to prove that they're vaccinated for this masking portion we're in right now, is a photo considered an official representation of their vaccination card? And I guess what would you recommend on this front of proving your vaccination?
Well, there's no official what qualifies and doesn't in terms of the state or the country. Certainly the card is what you get. If you lose your card, you ought to go back to the place where you got vaccinated or talk to your local health department, because you should be on the vaccination registry as well. I tell business owners, if people show their card or they show a picture of it, then you ought to accept it. If people are going to lie about being vaccinated, that's pretty unfortunate. And I think the CDC director said it, they're lying to themselves, and they are not protected, and they're putting themselves at risk. What we now know is that they're not putting vaccinated people at that much risk, which is lets us move in the direction we have. Catherine Collins, WLEX.
Thank you, Governor. Do you know offhand how many 12 to 15-year-olds have been vaccinated in the first few days it's been available? And just more generally, how does the effort so far to get those younger ages vaccinated, how's it going in your view?
It's going well. So this obviously first became eligible last week, but really we only started doing it on Thursday because we wanted it to go through the whole process. We have a whole lot of school systems setting up vaccination clinics. We had some groups taking reservations earlier. I think we have vaccinated 6,319 12 to 15-year-olds since Thursday. And I think that's a pretty good number when you think about most of the larger ones are being scheduled for this week. I think there are a number of high schools and middle schools and other places that are doing that. So 6,319 when we haven't been through a full week of this small of an age group, I think that's a good start. Melissa Patrick, Kentucky Health News.
Hi, Governor. So as of yesterday, there were only 3 red counties in the whole state. So my question is, are you all working to do anything to help them move out of that red zone, or is that still are you leaving that up to the counties? And especially Rockcastle County, which sits right on I-75.
Well, we still have our red county recommendations that are out there. We'll be looking at those certainly as we move towards the 28th and then the 11th. We work each week with the local health departments, answering calls as well as regular calls with our county judges. We stand ready to help with any advice, and for those that need direct aid and assistance, we're willing and ready. but I haven't had a direct communication, at least personally, from Rockcastle County to date. We're happy if there are specific things we can do to help, especially to get out of that red zone. We're stand ready to help in any way. Piper Hudspeth Blackburn.
Thanks, Governor. Has Kentucky had to ask the federal government for less doses because of a drop-off in demand? Some states have asked for anywhere between 8% to 29% of the doses allotted for them. And I was just wondering if Kentucky has had to make similar requests due to changes in demand. And yeah.
So just a slight technicality. We have a certain amount that's available to us, and then we order from that. We are not currently ordering 100% of what they offer to us because our demand isn't as high as what's been there. Now, we have contributed some of that excess to a federal pool to where it goes and can go elsewhere in the United States, states that have been hit harder, states that have active outbreaks right now. And we believe that while we want to make sure every Kentuckian is vaccinated, that we need to get this entire country vaccinated. And when we have less demand than supply here, we want other places to make sure that if they need extra doses, they can get them. When we don't order in a week the full allocation, we still have that full allocation available in the next week. So it lets us look at our demand coming from our vaccination sites. And when we're not using all of it, make sure that it goes to a good place and a good use. Corinne Boyer, WEKU.
Hi, Governor. Will the daily health check or healthy at work rule also expire on June 11th? Thank you.
So certainly parts of it. That's one, though, I'm going to have to work with Dr. Stack on. I don't think we have a definitive answer yet. I do think by that time, we've pulled back temperature checks at most places. If not before then, that's certainly not going to be a requirement at that point. But that's still to be determined. Chris Otts, WDRB.
Thank you, Governor. I want to go back to the very first question you took today about the federal unemployment programs. I wasn't really clear on the answer. I believe they expire under the federal bill on September 6th. Is it possible that you could eliminate Kentucky's participation in those programs before that date? Is that something you're considering? And hey, since there's no one behind me in the queue, maybe I could sneak in another question. Oh, there is? Okay. All right. Well, there's my one question.
Thanks, Chris. And I hear Chris is headed to New York for some type of fellowship. So congratulations on that. Yeah, yes, I will consider ending it before that September date. That doesn't mean we will. It's really trying to thread the needle or find the Goldilocks zone where we get the direct positive impact that those PUA payments have on our economy, especially retail, groceries, restaurants, while at the same time in getting people at the right level and built up back to work so we can take all those gains and continue them moving forward. I don't think it's an exact science, but I know that it would be premature to terminate them now. We need to be engaged in other efforts at getting people back to work as well. We're seeing some employers have real success at it, others working towards it, but there is going to be a group, I believe, that's coming back in the relative near term that are awaiting that full vaccination. But yes, that is something we'll consider, but I'm not doing it like some states that when it seems like everything now falls into red or blue or the politics of it. I just same way we tried to use science to battle this pandemic, we want to be smart about threading the needle the right way on the economy. Faith King from Wave 3.
Thank you, Governor. Last week, you mentioned looking into options for incentives for people to get vaccinated, with Ohio, for an example, offering a vaccine lottery program. Would something like that be an option here?
So we had the very first lottery program. Ours is, it puts you in a daily lottery where you can win, I think, 200 and something $1,000 instead of a bigger one for $1 million. We do believe it's going well. It provides, especially for places that have both the lottery and are vaccinating, think grocery stores and drugstores, announcements that they can make that they tell us are working better. I think you're going to see I know you're going to see some more incentives being announced by some of our locations here in the next week. But Faith, we're willing to take any good idea that we can do and put it into action. We just want people to be protected. We want to be able to push through all the misinformation and crazy stuff out there on the internet. These things are safe. They save lives. They've protected our most vulnerable. Please don't be manipulated. Listen to your doctor. Get good information. I want to protect every single Kentuckian out there, wherever you are in the state, whatever your other ideologies are. I don't want you to die. I don't want you to get sick. I don't want you to spread anything to other unvaccinated people. This is our chance. Let's get the vaccine. Let's defeat this thing. Let's move on with our lives. We can argue about all the other stuff afterwards, right? Let's get this done. All right. Thanks, Virginia, for hanging in. I promise my answers will be shorter to questions the next time around. I will always work to do better. Everybody else out there, I don't know about you, but end of last week felt pretty good. Long journey. We are nearing the finish line. Get out there and get that vaccine. I can't wait until we have June 11th. I can't wait until afterwards. I can't wait for a full normal school year, which I certainly hope and think that we'll have. And I can't wait to be a part of our economy and our opportunity just taking off. Thank y'all.